Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What does sharp pain in the right side of the chest mean? Sharp pain on the right side of the chest can result from a variety of issues, ranging from acute, short-lived, muscle strain to more serious conditions involving the heart or lungs. In women, it may be linked to breast changes or, less commonly, heart attacks, which are more typically felt on the left side in men. Infections like pneumonia or pleurisy can also cause sharp discomfort in this area and may require medical attention. /r/n/r/n Since sharp chest pain can be a sign of something life-threatening, it's important to know when to call 911 versus when to see a healthcare provider. Call 911 immediately if you experience sudden, severe chest pain that is accompanied by other concerning symptoms, like difficulty breathing, lightheadedness, or coughing up blood. /r/n/r/nVerywell, Junior B/r/n/r/n Females may experience sharp pain in the right side of the chest as a result of /r/n/r/n heart attack. The classic heart attack symptom is sudden, severe chest pain in the center or left side of the chest. However, females having a heart attack may note a burning sensation anywhere in the chest, not just in the center or left side. Some females have no chest pain at all, but experience other vague symptoms like nausea, cold sweats, or lightheadedness. /r/n/r/n Mastitis. The term mastitis refers to painful swelling in the breast that is usually caused by infection. The infection often occurs during breastfeeding due to blocked milk ducts or bacteria that enters through cracked nipples. Mastitis is known to cause sharp or aching breast pain and tenderness. Some people also experience signs of infection, including fever, and flu-like symptoms. /r/n/r/n Fibrocystic breasts. Painful, lumpy breasts are called fibrocystic breasts. This is a common and normal breast condition in which cysts and thickened tissues form in the breasts, usually due to menstrual cycle-related hormone fluctuations. Symptoms include swollen, lumpy, and painful breasts that get worse before your period starts and better once it begins. /r/n/r/n Breast cancer. A breast tumor may cause pain, but not always. In most cases, a breast tumor feels like a painless, hard mass with irregular edges. Sometimes, all or part of the breast swells. The nipple may also be painful. /r/n/r/n Clogged milk ducts. A clogged milk duct occurs when a milk duct becomes obstructed, preventing milk from flowing properly. As a result, milk can accumulate in the breast tissue, resulting in localized pain, tenderness, and swelling in the affected area. Some people may also feel a hard lump or knot in the breast. Clogged milk ducts typically only affect one breast at a time. /r/n/r/n Heart disease is the leading cause of death in the United States. Many forms of heart disease cause some sort of chest pain, including /r/n/r/n coronary artery disease, CAD. Coronary artery disease is the most common heart disease, affecting about 20.5 million U.S. adults. It occurs when arteries supplying blood to the heart become hardened and narrowed. CAD can cause pain on either side of the chest, including the right side where the ascending aorta is located. /r/n/r/n Pericarditis. Chest pain is a common symptom of pericarditis, or inflammation in the protective membrane around the heart, pericardium. It can be caused by infections, heart attack, heart surgery, and some medical conditions. Pericarditis pain typically affects the left side of the chest but can occur on the right. It is described as a sharp, stabbing pain that often worsens with certain positions and intensifies with deep breaths. /r/n/r/n Aortic dissection. This occurs when a tear in the aorta, the largest blood vessel, allows blood to flow between its layers, potentially reducing blood flow to organs and depriving them of oxygen. This condition causes severe, sudden, and sharp pain that can occur anywhere in the chest. It is often described as a tearing sensation and can lead to unconsciousness. It can result from trauma, high blood pressure, or connective tissue disorders like Marfan syndrome. /R/N/R/N. The three lobes of the right lung, as well as the lining of the right lung and associated lymph nodes, are located on the right side of the chest. The lungs themselves do not have pain receptors, but you may still experience pain that seems like it is in your right lung. /R/N/R/N. Possible causes of right-sided chest pain include /R/N/R/N pneumonia. This infection occurs when the air sacs, alveoli, in the lungs get inflamed, causing them to fill with fluid or pus. Pneumonia can lead to common symptoms such as a cough and fever, as well as chills and difficulty breathing. When the right lung is affected, pneumonia can also cause pain on the right side of the chest that may feel worse when you breathe or cough. /R/N/R/N. Pulmonary embolism. Pulmonary emboli occur when a blood clot, often originating in the legs, deep venous thrombosis, breaks off and travels to the lungs. If a clot lodges in the right lung, it can cause sudden, sharp right-sided chest pain that worsens when breathing, sudden shortness of breath, and sweating. /R/N/R/N. Lung cancer. Tumors in the right lung, its lining, or nearby lymph nodes can cause persistent, dull, or aching pain on the right side of the chest, which may also radiate to the shoulders, shoulder blades, or between the shoulder blades. Over 50% of people with lung cancer experience chest pain, often accompanied by shortness of breath or a persistent cough. /R/N/R/N. Collapsed lung, also called a pneumothorax. A collapsed right lung can cause pain on the right side of the chest. The chest pain will typically be sharp and stabbing and will get worse when you try to breathe in. Causes of a collapsed lung include a chest injury and lung disease. /R/N/R/N. Pleural effusion, also known as water on the lungs, is the accumulation of fluid between the pleural membranes surrounding the lungs. Pleural effusion often causes sharp chest pain that worsens upon coughing or taking deep breaths. It can be caused by heart failure, blocked blood vessels, infection, lung injury, and tumors. /R/N/R/N. Pleurisy. Pain in the chest is the main symptom of pleurisy, in which the pleural membranes are inflamed. This pain often increases with a deep breath or coughing and may also be felt in the shoulder. Pleurisy can be caused by a pleural effusion, as well as pneumonia or severe flu. /R/N/R/N. Gastrointestinal conditions, especially those involving the esophagus or organs on the right side of the abdomen, such as the gallbladder and liver, may cause pain restricted to the right side of the chest. /R/N/R/N. Gastroesophageal reflux disease, known as GERD for short. This digestive disorder affects the ring of muscle between your esophagus and stomach, the lower esophageal sphincter, or lay. If the lay doesn't work properly, you can get heartburn or acid indigestion. You may also feel pain in the right side of the chest alone. In some cases, the chest pain may resemble a heart attack. /R/N/R/N. Gallbladder disease, both gallstones and cholecystitis, infection of the gallbladder, may be felt as right-sided chest pain. This pain often travels through to the back and may also make its way to the right shoulder. The radiating pain may also lead a person to suspect heart attack. /R/N/R/N. Pancreatitis, inflammation of the pancreas is called pancreatitis. The pain associated with pancreatitis can be worse when lying down and better when sitting up. People with excess alcohol intake or gallstones are at an increased risk. /R/N/R/N. Peptic ulcer disease and gastritis, both peptic ulcer disease, stomach ulcer, and gastritis, inflammation of the lining of the stomach, can cause heartburn-like chest pain. Some people with severe gastritis compare the experience to having a heart attack. /R/N/R/N. Liver disease. Liver diseases such as hepatitis and cirrhosis cause pain that is felt on the right side of the chest. The pain mostly arises when the inflamed organ presses against the diaphragm. The pain is sometimes associated with jaundice, a yellowish discoloration of the skin and whites of the eyes. /r/n/r/n musculoskeletal refers to the system of bones, muscles, tendons, ligaments, and soft tissues that support the body and help you move. Some causes of right-side musculoskeletal chest pain include /r/n/r/n muscle strain. Muscle strains are one of the more common causes of right-sided chest pain. Many people can recall activities such as heavy lifting or a new workout program that they engaged in before developing this type of pain. /r/n/r/n costochondritis. This term refers to inflammation of the cartilage where the ribs connect to the breastbone, often due to chronic overuse without specific trauma, such as in furniture movers. It causes pain that worsens with activity or deep breathing and is tender to touch at the rib junctions. /r/n/r/n osteomyelitis. Inflammation of the fatty tissue in bone is called osteomyelitis. When it occurs in the rib bones, it can lead to sharp, localized pain and reduced function in the nearby joints. Very severe cases of osteomyelitis can lead to bone deformity. /r/n/r/n There are several other possible causes of pain in the right side of the chest, some of which include /r/n/r/n shingles, also called herpes zoster. Shingles is a condition that occurs when the chickenpox virus is reactivated. If the virus has been lying dormant in nerve roots supplying the right side of the chest, pain may occur in this region. About 1 in 3 people in the United States will develop shingles. Some of these people will have long-term pain as a result. /r/n/r/n mediastinal tumors. Tumors or swollen lymph nodes in the mediastinum, the space between the lungs, can cause chest pain that may be felt on either side, including specifically on the right side. Other symptoms include coughing up blood, night sweats, and shortness of breath. /r/n/r/n anxiety and panic disorders. Chest pain is one of the physical symptoms that often accompanies a panic attack. Others include rapid heartbeat, dizziness, and shortness of breath. These symptoms can also occur with other life-threatening issues. If you experience them and are not sure why, get medical attention right away. /r/n/r/n COVID-19 infection. Symptoms of the COVID-19 virus include chest pain that occurs with difficulty breathing, and coughing that may lead to chest muscle pain and tightness. Most people will recover from their symptoms, but about 5% of COVID-19 infections lead to severe cases and potential heart damage. People with long COVID chest pain may have lingering symptoms, with shortness of breath, chest pain, and palpitations or heart rate changes common among them. /r/n/r/n call 911 or seek emergency care if the chest pain is crushing or squeezing, and is accompanied by any of the following symptoms. /r/n/r/n Keep in mind that early stages of a heart attack are often confused for gas, heartburn, or indigestion, while pulmonary embolism is often confused by asthma, pneumonia, or pleurisy. If you're not sure what is causing your chest pain, see a healthcare provider as soon as possible. /r/n/r/n call or visit your healthcare provider if you notice any of the following. /r/n/r/n chest pain should always be evaluated by a healthcare provider when the exact cause is not obvious, i.e., mild trauma or injury. /r/n/r/n Depending on your symptoms and other factors, there are several tests your healthcare provider may order. /r/n/r/n But the first thing healthcare providers do is to make sure your ABCs, airway, breathing, and circulation, are stable. If it appears so, the provider will review your medical history and symptoms, and then do a physical exam. /r/n/r/n Healthcare providers may want to know when the pain started, where it's located, how you would describe it, what triggers it, and whether it's improving. /r/n/r/n Some conditions, such as shingles, can be diagnosed during a physical exam. Others require a more intensive investigation. This usually starts with these diagnostic tests, /r/n/r/n. Based on these findings, other tests and procedures may be ordered. For example, an echocardiogram may be done so a practitioner can see a moving image of your heart. A cardiac stress test may be done to measure the heart's response to physical exertion. /r/n/r/n. The causes of chest pain on the right side are many and may include heart, digestive, respiratory, or musculoskeletal problems. The pain may be caused by problems in the chest cavity itself, the upper abdomen, or even nerves elsewhere in the body. /r/n/r/n. Diagnosis will involve a physical exam and a review of your medical history and symptoms. Based on the findings, other tests and procedures may be ordered, including blood and imaging tests. /r/n/r/n. Right-sided chest pain is not as likely to be related to heart disease as left-sided chest pain, but that doesn't mean it is any less serious. If your pain is severe, you're noticing shortness of breath, or you just aren't sure if what you're experiencing could be life-threatening, don't wait. Call 911. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.